Eric Hartman again at ARVO 2025. This is day 3, good grief, and we have just finished the ICRN breakfast, and we have some of our good friends from London. Why don't you introduce yourselves?
Go on, after you, Mariya.
Yeah.
Well, thank you. Hi, Eric. It's so nice to see you again. So my name's Professor Mariya Moosajee. I'm a professor of molecular ophthalmology at UCL Institute of Ophthalmology in London and consultant ophthalmologist in genetic eye disease at Moorfields Eye Hospital.
Hi, my name is Dr. Lee Jones and I work in Mariya's lab. I'm a psychologist by background, and we've just started a project looking at sort of health comorbidities in choroideremia, and I'm particularly interested in hearing more about sort of the patient experience and sort of more of the lived experience dynamics of patients.
Okay, layman's term, what is a morbidity?
Comorbidity.
Yeah.
Comorbidity
Is
is
symptoms?
when you have other conditions
Okay.
alongside
I gotcha.
choroideremia.
Okay. All right.
And it's kind of trying to understand if the choroideremia gene is causing those other conditions or if they're unrelated to them.
Okay.
And as you know, we've done a lot of work looking
Sure.
at what we call systemic biomarkers, so
Right.
changes in your blood that could point to you having other kinds of conditions, such as maybe high levels of cholesterol or
Right.
a higher risk of cardiovascular disease. We found, interestingly, that choroideremia patients had high levels of serotonin, which could therefore affect your sleep. And that's something that then Lee took forward, so maybe you want to just
Sure.
explain
Yeah,
what you
sure.
found.
Yeah. So we've got a poster here on Thursday, but essentially we'd found that patients, so male patients and female carriers, self-reported significantly poorer sleep than sort of the general population, and so we said that could be due to the links with serotonin, but actually we found that these patients weren't any more sort of anxious or depressed than sort of the normative population. So we're saying that these sleep problems aren't necessarily linked to anxiety and depression, but actually it could be what Mariya was saying there about
Could be
this
more to do with your
systemic.
physiology. Yeah.
So what's the nutrient that you can take,
Melatonin
melatonin for
helps
for,
sleep.
for sleeping?
Yeah, you could do.
Okay.
I'm not going to prescribe that.
Okay, no, because I certainly wake up a number of times each night anyway. So,
Yeah.
well, that's really
But if
interesting.
that happens, it may be worth going to see a sleep doctor just to see
Sure.
what's going on.
Sure.
I mean, because it could be other factors
Right.
as well, and we wouldn't want to just say that, and it isn't for everyone.
No,
but
absolutely, yeah. Well, we greatly appreciate all the work that both of you do, and we look forward to working and pushing this research even further. So, thank you very much.
Thanks,
Fantastic.
Eric.
Thank you.
Okay. And we'll have more later.